So as you're traveling this holiday season, think about all of the things that you touch on a daily basis. Your phone, your keys, your car handle, the shopping cart, going through the grocery store, picking up items. You're touching a lot of things.
Yes.
And you may not always think about washing your hands when you get home. But I highly advise you to definitely take in precaution of some really good hand hygiene and to make sure that you are staying clean yourself. That will help.
Hello, I'm your host, Dr. John Bender.
And I'm Janessa Hanna.
And we're here for another exciting episode of What's Up, Doc? Today we're going to be discussing infectious disease, particularly the cough, cold variety. So 'tis the season, it's December. Wouldn't know it because it's like 50 degrees out right now here in Larimer County, unseasonably warm. Lake Loveland has not frozen yet. But would you believe we had another employee call out sick today, this time with COVID. Yesterday it was with influenza. Last week we had RSV. So we're seeing all three of these at the same time. Why does this happen? Well, at least in Fort Collins, we have tens of thousands of college students. They go home for Thanksgiving. They travel through the airports. They come back. And in the 25 years I've practiced here, about 10 to 14 days later, we just start seeing all these diseases tick up. And it's because of the spread from the mixing of peoples, if you will, through all of the terminals and bus stations, I suppose. We have seen a decrease in the death rate from COVID and flu. Tends to still hit grandma and grandpa, older folks quite a bit harder, sometimes the real youngest of children. There are vaccines to prevent them. And if you've not had your vaccine, the best time to do that was a little bit before Thanksgiving because of the timeline that I just mentioned. The second best time is now, because we will see these diseases easily into mid-February, early March, before they start to plateau again. There are some other symptomatic things that people can do. As a medical assistant, what supplements or other strategies do you recommend to your patients, Janessa?
Absolutely. So as you're traveling this holiday season, think about all of the things that you touch on a daily basis. Your phone, your keys, your car handle, the shopping cart, going through the grocery store, picking up items. You're touching a lot of things.
Yes.
And you may not always think about washing your hands when you get home. But I highly advise you to definitely take in precaution of some really good hand hygiene and to make sure that you are staying clean yourself. That will help. Also, some things that you can do to help prevent these things from happening are some just over-the-counter supplements. I recommend vitamin C, D, Zinc, and Elderberry. Those are all very good to help preventing these sicknesses during this time of year.
Well, it's interesting you mentioned vitamin D because vitamin D is dependent on sunlight. We know that in the wintertime, days are shorter because of the equinox and what happens with the earth circling the sun. And so we see vitamin D levels drop here in Larimer County, at least. And that's probably true most of the country. Sometimes I've even wondered, do we really have a flu season or do we just have low vitamin D season? And maybe part of what causes us to have less resistance to these diseases is the lower vitamin D levels. Also in the summertime, people tend to disperse. They're outside. There's a lot of people, but we're running around, walking in the parks. Wintertime, we tend to congregate, so people are much closer together. And so even if you're doing the good hand washing, may behoove you to wear either a social mask, or if you're serious, you can still get the N95s. Those will filter out the particles. And that's probably safest if you're doing a plane trip or if you're going to be at that bus terminal. And if you're sick, for goodness sake, please wear a mask. And even if you do great with COVID and flu, remember, grandma and grandpa or great grandma and grandpa may not. Literally, I'm not making this up, years ago, I had a college student come home, saw his family a couple weeks after Thanksgiving, and grandma caught influenza and died. And she had had the flu shot. Well, maybe the flu shot didn't work. No. It works. It's just as people get older, sometimes they can't make the antibodies like they used to. You know, we hope they do. We give double dose to folks over age 65. But one of the reasons we encourage everyone, including young, healthy people, to vaccinate is to protect their loved ones around them. If you're a caretaker, it's also important too. If you're providing care at home or in someone else's home, That's another important place. In the medical field, we require our staff to get these vaccines. We've done that for years. But if you're providing services outside the home or in a daycare, also very important. Any other advice for cough, cold, flu season?
Some of us have little kids running around that I like to call little journeys because they seem to really pick up on all of the gunk that's around. As well as keeping up with your own hygiene, please also make sure that you encourage and help your kids as well because they do learn from you.
As far as over-the-counter remedies, Tylenol is going to be safe for most individuals. Honey is a great cough suppressant, especially for children. My favorite over-the-counter, if you need something stronger, is dextromethorphan. If you get Delsym, Delsym, it's orange flavored, pure dextromethorphan in a sustained release preparation, not sedating. You can take 1 teaspoon every 12 hours. There's also the Tessalon Pearls, or benzoate, which will help suppress the cough reflex at the stretch receptor level in your lungs. Sometimes an antibiotic is necessary, but for flu, we use an antiviral, a little different than an antibiotic. You have to start it though soon, like usually within 24 hours. We try at Miramont to respond to people and get on their medicine as quickly as possible if they need Tamiflu. For COVID, we have Paxlovid. It's a little pricey. Some people can't afford it. Sometimes steroids can be of value, though, just to help prevent COVID lung and suppress that inflammatory response. For RSV, I don't know that anything works. They say the albuterol nebulizers really don't help. Here we do have a vaccine. It's been released for children for years, but now we have an adult RSV vaccine that we're administering to folks in their 50s and 60s and beyond. That's pretty much the updates on vaccines. I think we're at our time, so we're going to let our audience go. Thank you again for joining us, and stay healthy. Take care.